Good afternoon, and we are live in California. My name is Claire Day, and I am a Chief Program Officer with the Alzheimer's Association. And it is my absolute pleasure to be your host today as we talk about how Alzheimer's and dementia, government, nonprofit, and business communities are coming together to talk about how we can support caregivers and people living with dementia during the pandemic. We are so grateful to Governor Newsom for his leadership, and we share in his concern that we need to reach out to as many people as possible at this difficult time. We are grateful for the technology that's able to bring us together today while sheltering in place and prioritizing the recommended guidelines for safety. But technology can sometimes be unpredictable, so please bear with us if we're experiencing any technical difficulties in bringing us all together from different parts throughout the state. There's also an opportunity for you to ask our panel questions, so please use the comment section on our live Facebook feed to ask, and we will have our colleagues behind the scene helping to manage. Today, you're going to hear practical tips and general information from experts on their opinions. It's important to recognize we're not delivering personal medical advice here. And now it's my pleasure to introduce to you our opening presenter, Maria Shriver. Ms. Shriver is the former First Lady of the state of California, chair of Governor Newsom's Alzheimer's Prevention and Preparedness Task Force, founder of the Women's Alzheimer's Network, and the state's leading Alzheimer's advocate. We are honored to have you with us today. To join us, Maria, I'll turn it over to you.
Thank you so much, and welcome to all of you. Thank you all so much for joining us. This light just went out, so forgive me for that. They both just went out, so you've got me somewhat in the dark. But I wanted to begin by wishing everybody a happy Passover. I know there are many people probably gathering virtually to celebrate Passover. So I'm cognizant of that very important gathering moment in so many people's lives. I also know that it's Holy Week for millions of other people, Holy Wednesday. So I just wanted to say that I'm aware of both of these events, and I want to wish you well. Regardless of your faith, regardless of where you are in life, we are here with you. And I'm really grateful to be able to participate in this town hall because I think it's super important for people in the Alzheimer's and dementia, home health care workers and caregiving community to know that one, they're not alone. Two, to know that their concerns are being felt at the highest level of government and that there are people on the ground at the Capitol and really all over working on their behalf, thinking on their behalf, and trying to make this experience, which is a novel experience really for everybody, a little bit easier. We're also very cognizant of the fact that for those with Alzheimer's, routine is important. Having a consistent caregiver is super important. And I know that for many families, that has been disrupted. We're aware of that. I think the governor just a few days ago stepped forward and said, you know, for people who are feeling isolated and alone, they started a whole program to pick up the phone and call somebody who might be in that predicament. I hope maybe that has been helpful to some people. We're all here working together, the Alzheimer's Association, the Women's Alzheimer's Movement, the Department of Aging, the Master Plan on Aging, all the different healthcare providers in California, the Women's Alzheimer's Movement, the Task Force on Alzheimer's Prevention and Preparedness, and really the path forward. We have been meeting at Governor Newsom's bequest this whole past year, trying to look at how should California better prepare for the Alzheimer's crisis that we're experiencing now and in the future. And I think one thing we've learned through COVID-19 is how important it is to invest in medical research, how important it is to be prepared for what we know is coming. And I think this has just made it all the more important, the work we're doing. We know we're an aging state. We know that we have the highest population of people living with Alzheimer's. We also have the highest population of people who are caregivers. And we also have the highest population of people aging forward. So what we're experiencing today is something the state is trying to get its arms around, but it's also what we here are trying to do is have the state be prepared to get its arms around the next big crisis, which is Alzheimer's. And we know from traveling around the state that so many families before COVID. We're struggling financially, struggling personally, emotionally, in every way. We want you to know we've been hearing you as we have traveled around the state. And I think the most important thing, and I'm certainly open to everybody's questions, but what I wanted people on this Facebook Live gathering to know was that, and Secretary Wade will be talking in a minute about what she's been doing with the Master Plan on Aging, but that we have been crisscrossing this state, writing down what we've been hearing, meeting about what we've been hearing, working together to collaborate about how best to streamline what we've been hearing and to make the process simpler, more affordable, more accessible for everybody in this state. I think California has done an extraordinary job in this COVID response. You've seen the difference of leadership when it works. You've seen how important it is to work across different political affiliations, across different generations. I just did a Instagram Live with Governor Newsom, and he said that he had been humbled, really humbled by the 90,000 plus retired healthcare professionals who had signed up to lend their services to the state. So we have an incredible wealth, really, of human capital here in this state, people who want to help, people who want to be here to help their fellow Californians. And that's what we want to make sure that people in the Alzheimer's and dementia, caregiving, and home healthcare worker community know that we're on it. We're always open ears. We're continuing to learn. And our goal is to put together a master plan for the state of California that recognizes our aging situation, Alzheimer's as it is, and other dementias, and where we go from here. And so I think it's great that this is happening. And I'm really happy now to introduce Kim McCoy-Wade, who's running the governor's master plan on aging. We have been communicating, collaborating. Our cabinets are aligned in many ways, and we're working together, as I said, to give the governor the best possible report for the future of California. So Kim?
Thank you so much, Maria. I'm so grateful for your leadership all these many years, but perhaps now more than ever. Your commitment to California, your expertise on Alzheimer's and all things aging, and your just passion and partnership with all of us is exactly what we need to, as our governor says, meet the moment. So couldn't be more grateful to be side by side with you at this really unprecedentedly tough time for all of us. I want to thank everyone who is first and foremost staying at home and saving lives. We are seeing the result of all of our work to stay at home and save lives. And we want to say thank you and keep it up, and also just acknowledge how hard it is. It is disruptive for all of our lives, our work, our families, our caregiving. There can be moments that are incredibly stressful and overwhelming as routines are disrupted, as health is disrupted, as respite care, even our self-care, walking or worship or other things have all been thrown a loop, to say the least, by the need to stay home and save lives. So we know that, we see you, we hear you, and are working night and day 24/7 to both bend that curve as we need to, flatten that curve as we need to, but also take care of each other. So let me just spend a minute on where we've been, where we are now in this extraordinary moment, and where we will go next. And then I really want to hear from all of you about what you need from us in partnership and leadership. So where we have been, as Maria has said, as last year the governor said, California is changing. To be a true California for all, we have to meet the changing demographics as more of us age, and aging is changing with greater racial diversity, more of us living alone, more of us facing poverty, and this incredible challenge of dementia and how it really does just wreck our health, our finances, and such a challenge. And so charged us to do the master plan for aging and charged us to do a plan on prevention and preparedness for Alzheimer's. And so grateful again for that partnership. Honestly, we have been racing towards that finish line, but now we have had to pause and pivot and laser focus on the response, using all that we have learned from listening and working together and hearing from you the areas of priority. And as I sometimes say, instead of writing a 10-year plan, we're writing a 30-day plan, a 60-day plan, a 90-day plan to make sure that we are responding to the need of the moment. we have done a couple things. First and foremost, we have had to move all of our programs to what we're calling beyond walls, without walls. If we used to go to a community center and get a meal, that meal needs to be delivered or drive-through pickup. If you were coming to a day center, how can that day center still provide that vital healthcare, that vital engagement, but not at the center? The center's closed for public health reasons, but still providing services beyond the walls. So thank you to all of you on the front lines who are still delivering nutrition, delivering engagement, delivering health, keeping residents and facilities safe, even though you can't do it the way you've always done it. New innovation, new partnerships, new technology, and even new use of the old telephone. So thank you to all of you for that. And then the second piece is we really have launched this check-in campaign, not just stay at home, not just save lives, but check in. We're challenging all of us to make those 5 phone calls to anybody you know. Maybe it's your family, maybe it's your dear friend, maybe it's someone you don't know that well, but you started connecting with them because you think maybe they need a connection or you need a connection. So we've challenged all of us to do that. Our governor has really challenged all of us to keep those check-ins going. And of course, once you check in, sometimes people do need help. And we are calling all of us to appeal to our best spirit, our volunteerism, our neighborliness to take care of each other, but also we're going to need more help. So the governor has moved to create a state COVID info line, a telephone line to go with the COVID info webpage. We can put some of this information in the chat, but of course, covid19.ca.gov is your webpage. And that one-stop phone number is 1-833-544-2374. I wish it was a catchy jingle, but we're moving fast. That's the number, 1-833-544-2374. And from that, a warm handoff to our local partners, 211. 211 will know the resources in your community. We're working to strengthen our 211s. You can always call 211 directly, growing to every county, so you can get that help you need. But equally important, we want to make sure that you have helplines. And the Alzheimer's Association has been a leader in helplines, and we're so grateful for that. One of the first things I did was visit that national hotline resource in Chicago and learned so much. And we're applying it now in California to strengthen our aging and adult info line, a longstanding line that is modernizing to meet the moment, connect you with your local aging and adult info. We are working in partnership to expand the friendship line in the Bay Area, which is a behavioral health. Anytime 24/7 need to talk to someone, reach out. We know people are feeling alone, having tough moments, worrying about new anxieties. The friendship line is there for you. And we're also expanding the line you can call if you are concerned about abuse or neglect of older people. Adult Protective Services is what that's known as. Every county has one, and we've added a 1-800 number to make it easier for you to reach out if you're concerned about someone, need a wellness check, or have more serious concerns. Those are all there. So we'll put those numbers out. We're blasting them out through our check-in campaign. I want you to know that if you do reach out and find someone who needs help, that's exactly what we're asking, and we want to make that help easier than ever. Just a minute on where we're going next. As we stay checking in, we really want to emphasize the staying connected. Just as important as our physical health is our mental health. How do we stay connected? We're partnering with Walgreens to push out activity guides to feel good and stay connected. We also know that we need to support our families and friends who are caring for each other and working in partnership with Alzheimer's Association again, starting a telephone call-in series where we can provide family and friend support, whether you were caring for someone in your home, caring for someone in a residence, or caring for someone long distance, as many of us are doing, all of those things. And of course, all important self-care. And I'll give you a sneak preview. May is Older Americans Month, and the theme couldn't be more prescient. It's Make Your Mark. And we think Make Your Mark is the perfect echo of our governor's challenge to meet the moment. And we'll be partnering with new and different and more folks to help all of us make our mark as older people, protecting and supporting older people as we're in this to win this for the long haul and want to be there with you. So let me stop and get out of the way. We do want to help you on all of this, on the good days, on the bad days, and even some of the toughest conversations, the COVID conversations, we're calling them, that families need to have as we enter these tough days. We want to hear from you about how we can help you with those connections. Stay home, stay healthy, stay connected. Thanks.
Thank you so much, Kim. And I just want to encourage everybody to keep those questions coming in the chat feature of our Facebook Live or the comment section of our Facebook Live. Such great information. And we're so grateful that you're able to stick around and hopefully answer some of those questions for us at the end of the broadcast here. Next, I'd like to introduce our next presenter, Dr. Canio. Dr. Canio is a practicing geriatrician and psychiatrist in Northern California and is a member of the governor's Alzheimer's task force working closely with Maria Shriver. I'll turn it over to you.
Thank you. So caring for a loved one with dementia, such as Alzheimer's disease, is hard enough during normal times. You, as a caregiver, are the most important resource of people living with dementia. On behalf of the California Governor's Alzheimer's Prevention and Preparedness Task Force, I would like to thank you for your care, especially during this challenging time of COVID-19 pandemic. As a geriatrician and a psychiatrist, I'd like to reinforce the public health recommendations, revisit skills needed to care for someone living with dementia, and review the importance of future planning, especially with regards to end-of-life care. Although the information about this new virus changed daily, one consistent message is that older adults with severe chronic conditions such as heart and lung disease are more likely to become severely ill and die from COVID-19. Dementia does not increase the risk of COVID-19. However, dementia-related symptoms may increase risk as possible with the people with dementia may forget to wash their hands or take precautions recommended by CDC to avoid contracting the virus. So what are some of these precautions to reduce the risk of getting COVID-19? Practice social distancing. I can't thank the governor enough for issuing shelter-in-place order early. This has allowed us to better prepare for a possible surge in the future. Wash your hands with soap and water at least for 20 seconds or use alcohol-based hand sanitizer with at least 60% alcohol. Disinfect surfaces in your home. Now, let's not forget the usual recommendations to take care of your health. Take your medications regularly. If you don't take your medication for asthma, you may end up heading to the ER for asthma exacerbation, and that's the last place you want to be at. Exercise and eat right. Some of my patients have asked for recommendations. What can they do if they can't go to the gym? As an older adult, there are shows on TV that can help you out, such as Sit and Be Fit. Connect with others via FaceTime or phone. Schedule telehealth appointment for routine physical and mental health checkup. Since the shelter-in-place order was issued, I have been able to care for my patients using video and telephone. Most of my patients who do not have dementia have shared their feelings of anxiety and depression, which I have treated. If you are experiencing some of the symptoms associated with COVID-19, such as fever, shortness of breath, or cough, please call your healthcare provider immediately so that they can advise you accordingly. For a person with dementia, monitor for worsening of usual confusion, especially if associated with other symptoms, a condition we call delirium, as this might be a sign of other medical conditions that require treatment. I'd like to share some of my video visits with you recently. Yesterday, my patient's granddaughter was so frustrated. She said, I don't know what to do. She keeps going outside, getting the mail, and doesn't wash her hands right after. She thinks she's being punished for not being able to hang out with her friends. She gets really upset when reminded what's going on. Another patient's son was feeling frustrated and stressed out as his dad would call him 6 to 10 times in an hour while trying to work from home. His father was feeling abandoned as he was told to stay in his room without any group activities while in an assisted living facility. Unfortunately, I have several similar conversations daily. I acknowledge caregivers' frustration, and I remind them about having realistic expectation due to their inability to process all of this and to use disease-appropriate language. Keeping things simple usually help. There are online resources and individual telephone consultations with community organizations. Some of that information was already shared by you today. If you're if you're already applying behavioral intervention and they have not been effective, call your loved one's physician, as medication might help in alleviating some of the symptoms of fear or panic. Don't forget to take care of yourself as well. This is very important. As a geriatrician, I review my patients' goals of care with them, or sometimes with their loved ones whom they appointed as proxy, to help guide their care and be an effective advocate for them when needed. It is important to review those documents called Advanced Healthcare Directive and Physician Order for Life-Sustaining Treatment or POLS, and that's usually a pink form if it's available. That will let us know who the legal spokesperson is if it's not you, and make sure there's an alternate as you might get sick. These documents will help you understand your loved ones' wishes in case you have to act on their behalf. If it's not available, make sure you complete one. As I've been doing telehealth the last few weeks, I've noticed that some people's goals of care have changed. When asked if infected with COVID-19, some patients have expressed their wishes to stay at home rather than being taken to the hospital. Some have said, take me to the hospital, but I wouldn't want a life support if it gets to that. Or yes, please say one of those ventilators, even if there's a small chance. So older adults, especially the ones living with dementia, are vulnerable during natural disasters and crisis. And this has been especially true during this COVID-19 pandemic. As the virus continues to affect our communities, please know that the healthcare professionals are available to support and guide you. Thank you.
Thank you so much, Dr. Canio. You know, that's such great information. And I know we have a lot of questions that are coming in, and we'll be able to get to them in just a minute. I wanted to, not to put her on the spot, but Maria, you look like you were going to say something. Did you want to add something? No. Okay.
I can say anything, but I thought both of the presenters did a great job outlining what we've been doing and practical advice for the here and now.
Great, great. So I want to take just a minute just to talk a little bit about the Alzheimer's Association's response to COVID-19 and what we've been doing nationwide, but certainly here in California, like all of the organizations that we've heard from, we transitioned to online programs and support services, including education and support groups, as soon as that shelter-in-place mandate was put into place by Governor Newsom and other local authorities. And so what we've been able to do is really provide an opportunity for caregivers and people living with Alzheimer's disease and related dementias to still be able to access education, their monthly support groups, all of those lifelines that everybody referenced during that time, during some of their comments. And so I want to make sure that people know about those opportunities. Of course, we've heard today about the great reference numbers that Kim provided through 211 and through that special COVID number. It's worth repeating, 833-544-2374, but additionally through our 24/7 helpline, which has always been available through the Alzheimer's Association, 800-272-3900. We know that caregivers at home are now struggling with potentially not having other family members or their formal or informal support systems being able to come into the home anymore and support them. Respite services aren't as readily available as they used to be. And so while there's lots of information that I could provide about what caregivers can be doing who are based at home, we want you to call those numbers because you can get a specialized personalized plan that will meet your individual caregiving needs. But I have a couple of tips that I wanted to share with everybody. Some of the top things that we've been hearing through these support groups and educational programs, with my colleagues across the state, we've educated more than probably 200 caregivers just in Monday, Tuesday, and Wednesday. So we know that people are finding new ways to join these virtual programs. They're learning differently than they ever thought they would before through some of these online or telephone-based programs, but they seem to be working, and that's a really good thing to keep people connected as Kim mentioned, staying connected, that social isolation is a big thing. So those top 4 tips that I would share, first is, I think, as for those that have loved ones at home, it's okay for you to be that gatekeeper for people that would be coming into your home, to make sure that they're following all those great recommendations that Dr. Canio just reviewed, that is keeping you and your loved ones safe, that it's okay to be that gatekeeper for anyone coming in the house, regardless of what service they're providing, even someone that's coming in to help with maintenance or anything in your home. We know that families are watching a lot of news, and that can be on in the background. We heard on one of our early stage support groups just this week that people with the disease are saying that the news is becoming a little bit overwhelming. So it's okay for you to limit that time and make sure that you're limiting the time of that sort of 24-hour news cycle, so that you can have more opportunity to engage in different things rather than just sort of constantly increasing the anxiety that could be created by watching the news and learning some of the new and recent updates that we're getting. We want to get that information, but find ways to limit it. We've also seen that families can have a hard time, or that people living with the disease can have a hard time understanding why they're not getting to visit with those loved ones, why they can't see their grandchildren, why they're not able to get out and about the way they would. And so find those ways to stay connected virtually, either through some sort of online platform, or being able to share even through a basic telephone call, like Kim mentioned. And we know that translates into care and support for those who have loved ones that are living in long-term care communities. We know it is in the best interest of those other residents and all of the staff working in those healthcare communities that visitors are limited or excluded, and we want to support that. But I know it's not the same as being able to go in and hug your mom or hug your dad. And so find that connection within the organization, call those long-term care providers, and find out ways that you can continue to have those connections. I have a friend in Vermont who has a mom in a memory care facility, and they've created Skype meetings for her and her mom so that she can continue to have that weekly or even daily, if needed be, connection to her mom. We need people around us more than ever at a time when we know that we can't always be around people. And so we have to work together as a community to find ways to keep each other connected. And so I would encourage you the most that you can to reach out and know that all of these community-based organizations are working together to support you in your home, in your community, day in, day out, 24 hours a day. And so I want to we have an opportunity now to go to some of these questions. So I'd like our presenters to be ready, because we don't know which question you're going to get. I want to start with just a little anecdote. Maria, this is for you, to thank you specifically for what you're doing. It was a hello from Arizona. She is a caregiver for her wife, who was diagnosed at the age of 55 just 4 years ago. She loves your Sunday newsletter, and always has an amazing information in it. And Maria, she calls it a lifeline for her.
Oh, wow. Well, I wish I knew her name. Do you have her name?
I can share her name with you. Yeah, I'll share it with you. Yeah.
Okay. Well,
yeah.
Anyway, thank you. The Sunday paper is a labor of love, and I love when people call it a lifeline. It's kind of become that for millions of people, and in a way, it's that for me too, which just tells you, I think, how important all of these digital connections are. I feel like the people that respond to it, I feel like I know them well. And I try to include in that paper, and I'm going to be doing more in the coming weeks about Alzheimer's. The women's Alzheimer's movement obviously is on the ground, working to try to understand from a research point of view why women are disproportionately impacted by Alzheimer's. The governor's task force that we're doing is looking at the disproportionate impact in the minority community and in the female community, but also mapping a map out for everybody. But I'm going to start including a lot more in the Sunday paper, information about Alzheimer's, information for caregivers. And I know while we've been hearing a lot in the news off of the question about the news, I'm in the news and I don't watch the news. I watch the news for like a half an hour in the morning, then I turn it off. I check in with it about 20 minutes at night, and then I turn it off. And I do that for my mental health and my emotional health, and I'm in the news. So I just think it's helpful, because otherwise you're kind of wired up and it changes all the time, and you can get it summarized at the end of the day, so you don't need to watch it all the time. But I think, you know, we can all talk a little bit about home health workers. We hear so much about getting masks for people who are in the hospital, in the emergency room, but those working in the homes, those of you who are caregiving, you're also first responders. And I think that's why we wanted to do this, because we recognize that you're first responders. Last figure I saw, 17 million people in this country alone caring for people with Alzheimer's and dementia. And that's kind of lovingly caregiving and lovingly caretaking. So thank you for your love, because that's what I took it as. And I will continue to try to produce the best lifeline possible, and continue to include issues about brain health, issues for caregivers, and issues for those on the road with Alzheimer's, and also what we learn about how best to prevent it, because that really is a lot of also the work that the task force is doing, looking at kind of the most up-to-date research about what we know. There is no magic bullet, just like there is no vaccine for COVID, but we do know these things that might help us prevent COVID. We do know certain things that might help us delay or may help us prevent Alzheimer's. And so they are many of the things that we discussed here today. They're not washing hands, but they are turning off the news and having some sort of being able to manage your stress effectively. It is having connection. It is eating well. It is sleeping. I myself have a meditation practice, and there's a lot of apps now that you can access for free, actually, to help you with a meditation practice that helps calm your mind, and that might also be helpful for those with Alzheimer's. You can try different versions of that. Music, learning something new. I think these are kind of practical pieces of advice for those who might be caregiving, who might be in a support group. And as we learn more things about those who actually have, whether it's MCI, mild dementia, or more progressive dementia. When my dad had dementia, he found that kind of reciting his prayers and watching Mass online or going to Mass was a very calming experience for him. So we do know that certain things work for certain people, and so we will continue to try to look at those things. That's a long-winded answer to thank you to send the paper.
Oh, that's great, Maria. Thank you so much. I wanted us to spend a little time in the next couple of minutes talking a little bit about the need to ensure that we have programs and services and support programs for our beautifully diverse state of California. I especially want to mention, certainly we want to make sure that we have things that are translated in languages. I know at the Alzheimer's Association, we're offering educational programs in Spanish and Chinese, as well as having educational opportunities that way in those languages as well. But we also want to think about the need to meet our LGBT community, and how people that are living alone or who have an unidentified care network, maybe don't have a care network, how are they doing in these times amid COVID-19 and a shelter in place? So Kim, I wondered if you could start talking a little bit about some of the services that might fit there, that sort of go along with some of the work that the Alzheimer's Association is doing in that space as well. And you're on mute.
There we go. Absolutely. The governor, as you know, is very committed to a California for all. And in the master plan process, we have really tried to walk that walk with a new equity work group to ensure that all the work we're doing on aging is informed with that equity lens and equity, putting our values into action. And so we were able to reconvene that group and get some really great advice and direction. Absolutely, it included the language translations, both the written materials, which we as a department have always tried to do English, Spanish, and traditional Chinese. We're expanding into Hmong and Vietnamese with some of our new materials, Korean, as well as we're trying to deepen our written translations. Of course, that has to be mirrored on the spoken services as well. Of course, it's beyond the words. We also want to make sure we're relevant to all the different configurations of families and aging in our state. And so that involves things like deep partnerships with community-based groups that we are looking to broaden and deepen. It also, our nutrition programs want to make sure the food is culturally relevant. And increasingly, we're looking to expand our partnerships with local restaurants that are struggling to stay in business and workers who need jobs. Can we have a win-win situation where that former community center that served older people is now closed? But you know what? We could deliver those meals. We could buy them from a local restaurant. So we're really working hard to forge those partnerships and try to benefit the community deeply. I should say we're also looking at data. I think many people are very interested to make sure that we're tracking how the disease is spreading and different community impacts. And we've seen in California, some counties come online this week with data from San Diego, some data from Los Angeles, some data from San Francisco, hoping that we can be clearer about where both that testing is needed, but also the supportive services, and again, making sure that they are culturally relevant. And I think this issue that our LGBTQ brothers and sisters have been very strong in reminding us all is that families come in all shapes and sizes, and to make sure that we are really defining the circle of family and friends broadly. Many of us, you can live alone, you can live with family, it's family of choice, it's family of origin, and making sure that whatever your connections are, we help you make them, strengthen them, keep them, grow them. They're critical whether you are in a residence, whether you are in a residential facility, whether you are at home, whether you are 1,000 miles away. Another piece of this is on our mind, which is so interesting, of course, is the digital divide. We're really finding that, of course, connectivity is going to make a difference of your experience at staying at home. One of my colleagues has parents who are highly online and in-laws who are highly not. And their experience of staying at home for days, for weeks without that connectivity is different. And so, of course, it brings up issues like rural communities having broadband access. It brings up issues to what's the device that people have access to affordably. Maybe it's the cell phone, and how can we maximize all the things that you can do with your phone, but also how can we increase access to some of the newer technologies that are really quite user-friendly, entirely voice activated, that make it easier to do telehealth, to do one-on-one conversations, to order your prescriptions or your food. So really looking at that connectivity piece too, and how different communities and different cultures may be wildly online in a certain social app, or maybe really offline. So I think we're just trying to provide that lens to all of our in-person services, our digital services, our informational services, and really be led by the communities on the ground. And I just want to say, to the Alzheimer's Association, I was very struck by your webinar earlier this week, entirely in Mandarin, as I understand it, with more than 500 people calling in, presenting and participating. And we need to replicate that in all of the dozens and dozens of languages that are spoken here in California.
Thank you, Kim. And it's kind of you to say, I think that one of the things that I've noticed throughout this process is how community-based organizations and organizations like yours are really stepping up in a different way to think about technology beyond just the fancy Zooms, right? And we've had these conversations at the Alzheimer's Association that some of our programs won't necessarily get any uptick if it's done virtually. And so how can we think about doing a program or an educational opportunity that might just be on the old-fashioned telephone, and think about what connection can look like for that individual, and really tailor make some of this so that we can get to people where they are in the language that is preferable for them. And I loved what you said about families, and we certainly want to ensure that the strong work that we've done within California, within all communities, continues and doesn't get stopped by COVID. And I think that's what today is all about, right? Is showing that we are resilient and we can continue to work together. I've seen a lot of comments in the Facebook from our community organization partners. There's so many great resources, and that's why 211 is such a great resource, as well as the Alzheimer's Association helpline. Dr. Canio, I'm going to turn to you for our next question. which is specific around what steps can be taken at the ER when a patient with dementia is in emergency care during this crisis. This person had a specific incident where the person was admitted, and it was problematic because of the dementia diagnosis. So are there specific steps that family members, the constituents, can be taken if they do end up having to go on an ER visit that would be beneficial?
Yeah, during normal times, we would normally ask family members to come with them to the ER visit, but at this time it's hard. They're being asked to stay at home, and but providing information, calling the ER, providing more information about what led to the ER visit, letting them know their usual state of mind so that they can assess accordingly and provide any challenges that are happening at home so that if they need some support that can be addressed during that ER visit.
And do you have specific information, especially right now when family members aren't allowed to go into the ERs? And so someone with dementia, do you have some specific information that families could use to help with this? Is there any way around that?
I don't know of any right now. I actually had a patient yesterday who was in the ER and did call me and ask me what can he do. I did say, stay by your phone, because the ER doctor who I just talked to said we'll call him and have the social worker also call the family member. This is really tough situation for our patients, which is why I'm doing my best to do my part in the clinic, is so that if it's an unavoidable visit, we can hopefully avoid that. If knowing the usual symptoms for dementia would help with preventing these visits. Just calling the primary care provider first before the ER visit would probably help.
Yeah, so I took a lot from what you were talking about, making sure that through telemedicine and through those initial calls, maybe there's a way to actually avoid that visit. Yeah. So Maria, I'm going to turn it back to you for another question. This one specifically, and I know you talked about the great work of the governor's task force. Have any of these restrictions stopped the work? Are you guys planning to continuously move forward with your work, even with COVID-19?
Absolutely. We just had a big task force meeting. I think it was last week by Zoom. And we had a huge participation. Kim Wade, who's on here today, joined us to talk about the work of the Master Plan on Aging. We were also joined by the Task Force for the Future of Work, because what we've discovered is that many of the recommendations that all three of our task force were looking at similar recommendations. So we're trying to drill down on what the Alzheimer's Prevention Preparedness Task Force really should be recommending, that's Alzheimer's and caregiving specific, and how we can work best with the Master Plan on Aging and the Future of Work, because the Future of Work involves a much bigger caregiving workforce. The Future of Aging involves more cases of Alzheimer's, involves more geriatric doctors, involves more people, once again, in the caregiving force. It might involve more telemedicine. It might involve more doctors working in rural areas. It might involve more loan forgiveness for students to get into these professions. So collectively, we're looking at all of these things. Our original date to hand these recommendations to the governor was in the fall. Probably in December. We're looking at all adjusting our dates depending on where we find ourselves, because we don't want to give the governor something that he can't focus on, or that we don't want to give him recommendations that he actually can't bring to life. So we're moving forward, but we're also mindful of the situation that we're all in. And we're looking at ways to continue to hear from people, collaborate, as I said, simplify. And if there are people on here that have specific recommendations that they want the task force to look at. They can always, give us these recommendations, send them to the Women's Alzheimer's Movement, which continues to work kind of boots on the ground on behalf of families living with this disease and maybe confronting it for the first time. Because even though COVID has got everybody's attention, let's not forget that every 65 seconds, a new brain develops Alzheimer's, and the 2/3 of those brains belong to women. So there are many people who are struggling to get a diagnosis. Then they struggle. One of the things that we've heard over and over again is that people struggle across the state to get a diagnosis, that they find they have to go to so many doctors. So looking at a standard of care is one of the things that we're doing. And we're, of course, doing this across diversity, across gender. As I said, it disproportionately impacts women and people of color and the Latino population, but we're looking at California. There are 40 million people in this state. So we're looking at the numbers in our state and who's in our state. So we're sensitive to all of the different populations in our state. I just want to always reiterate that. But our work continues, but I honestly don't know if we'll meet the recommendation due date that we had before COVID. I'm fine.
Okay. Well, and I think it's such a great point to illustrate, because there really needs to be this balance right now about how you referenced it. We need to be sensitive to what's going on. And yet there are all of these caregivers and people living with the disease that still need to get through each day. And how do we balance both of that? So it's great advice.
Was going to look at trying to do these Facebook Live conversations moving forward that are like, what do we know right now? What is happening right now? What do you need right now? And I think that that's the right now is changing every day. What you may have needed last week is very different than what you may find you need today. Maybe you had a caregiver who could come in last week and can't come in today. Maybe you had some hunch about a diagnosis last week and you have a very different diagnosis today. So we're all kind of operating in real time. I think that's why people wanted to have this town hall meeting. If there's a demand for it, we'll do it again. I think the most important thing I think that this town hall wanted to convey was that we know you're out there. We're cognizant that this is changing every day. So the website that the governor has set up is also changing in real time, and that those who are living with dementia, Alzheimer's, special needs community, which is also impacted, obviously every community is, but that we're trying to update that website in real time, trying to call on Californians, all of them to be of service. So I think everybody's working together, but if people have an idea that they have not seen addressed, they should bring it forward so we can look at addressing it, and I can kick it over to Kim because she can address it.
Yeah, and I think that's great. One of the things, I know we're not going to get through all of the questions, and so it's a great time to highlight that we are going to gather the questions and keep them coming to the people that need them to be able to either answer them back to families or to get them where they need to go. Kim, we've had a couple of questions specifically about 211. You and I have both referenced it a couple of times. And I'm wondering if you could, people are asking, well, what exactly is 211? So I wonder if you could just do a little PSA for us on explaining what 211 could do for families.
Sure. 211 is really meant to be, it's a nonprofit partner, it's locally based. It's really meant to be that one stop where you have a question about maybe some help you might need in the community, whether it's food, whether it's housing, whether it's a volunteer need. It's really meant to be, not to call 911. These are not emergencies, but really to be that way to navigate. The beauty of our communities is that they're all different and they all have wonderful community-based, diverse range of local groups with their own names. But that can also make it very hard to navigate. And so that's what 211's job is to be that expert on all those different community services and public services as well, and help make that match. Again, they're the generalists. You can never go wrong starting with them. And every community has specialized services like our aging adult info lines that our local area agencies on aging will run, the Alzheimer's line. There are always specialized line, but when you don't know where to start, or if you know you have many questions, you can dial that 211 in most communities. And I believe as of last week when we announced, it was everywhere but five counties, and they are moving to quickly have coverage there so that it truly can be that front door, that telephone front door all across the state.
That's great. And Kim, while you're off mute, I'm going to ask a follow-up question for you, which you may not have an answer for.
Okay.
And so, but this is specific to somebody asking, they have a loved one in their facility that obviously is sheltering in place and under lockdown, and they want to see how they can help. What kind of advocacy work can they help to make sure that those facilities have what they need? Like if there's do they need something? How can family members that are in the community advocate to get what the facility might need?
So great question. So I think, yes, absolutely. Staying in touch with your loved one inside. Again, the phone is the best tool, but a video is even better. And as you learn of those needs, I would always start with the facility itself. They are, of course, many of them deluge, and there's such a diversity, right? Big, small, residential, more skilled nursing, but start with the facility. I will say that we're very proud at the Department of Aging that we are the home to the Long-Term Care Ombudsman, which is a long and historical program. We've got about 100 staff all over the state and about 600 volunteers, and this is their job to protect residents' rights. And you can always contact your long-term care. It's a very formal name, forgive us, but the Long-Term Care Ombudsman, say that 3 times fast, but the Long-Term Care Ombudsman is really that people's advocate, the family advocate, the resident's advocate. Whether you have a specific individual concern about a particular person or more generally questions or concerns, they can help. And they, like all of us, are not really going in the facilities right now, but they are absolutely calling the facilities, staying in good touch with the facilities, and if need to, absolutely can escalate through appropriate channels, including licensing departments and law enforcement as needed. So the Long-Term Care Ombudsperson, and you can find them at our website, aging.ca.gov, or through your favorite search engine.
Thanks so much, Kim. And I want to, first of all, I think we're going to add some resources also about another member of the task force talking about COVID-19 and Down syndrome. There's some question and answer websites that have been put up through the National Task Group on Intellectual Disabilities and Dementia Practices. And we're going to add those links to the comments so that people have access to them. Thank you, Paula, for sending those to us to get to this discussion, because really a valuable part. Kim or Maria, is there anything you wanted to add about that and the work with the task force?
I can just quickly add that at the state level, the Department of Developmental Services works very, very closely, of course, with local regional centers that are on the front line of serving those communities and are very aware of the early onset of dementia in the population. And my colleague is Nancy Bargman, and just leading the plan to really make sure people are both conditions are thought of, and then particularly in this moment that there is what we're calling the good surge planning to keep people safe at home. So there is a lot with your local regional center would be the other reference I would suggest.
Great, thank you. And I'll just one more question, and then I think we're really close to being out of time. It's amazing how quickly an hour can go. And that was it's a little bit more of a comment, but I think it's worth noting here. We've seen a lot of recognition for doctors and nurses, well deserved. But this person was also talking about how are we supporting and giving public recognition to in-home and in-facility caregivers, those home health aides, IHSS workers, and making sure that they are getting the personal protective equipment they need. They are getting the recognition. Just if anyone had any thoughts or comments they wanted to add to that. Kim, you're muted again.
This is Kim again, and I can just absolutely say that is top of mind, that we very much recognize that it's not just the formal frontline medical professionals, it is the home care workers, it is the family caregiver, it's the grocery store worker who have needs for personal protective equipment. So those needs are all being routed through local emergency services and being triaged, but I'm absolutely in conversations every day about how we need more. and that circle of who needs it is larger than might have been originally conceived of. So absolutely, that is, and again, PPE, hygiene, all telehealth, broadband. I mean, there's so many things that are part of planning to keep us all home and safe and healthy that need to be considered. Claire, if I can, I just want to key off of where Maria started us with, which is that many of us will be gathering with friends and family this weekend for holidays and special gatherings. And I just want to return to seize the moment for these conversations. And I want to offer 2 resources to do it. I mentioned earlier COVID Conversations, which is a new toolkit that I didn't properly credit to the Coalition for Compassionate Care. But COVID Conversations is a toolkit to help have some conversations about how you and your family might want care to go. And another terrific resource in English and Spanish is Prepare for Your Care, just announced last week by UCSF. And these are all ways to have that conversation prompt, to talk about what your wishes might be, and to do the Advanced Care Directive. I mean, these are challenging conversations, but it's all better to be prepared and planned. And if we can help you do that, we want to do that.
Tee off of what Kim was saying, I think I've been trying to talk quite a bit about home care, home health workers, those who work in nursing homes, those who work in people's homes. And I think Governor Newsom announced last night that he had just procured 200 million masks for people who need them here in California. And the Women's Alzheimer's Movement is looking to try to kind of develop a program that would get those masks and attention to those home health workers. So I'd love to work with Kim on that to make sure that we're kind of signaling them out, because I don't think we've seen much. They've been somewhat invisible in all of this, not to take away from all the incredible doctors and nurses in our hospitals who are really holding down the front lines, but there are so many millions more holding down the front lines at home as well. So we're looking at it. So if people have ideas about how we could get those masks to home healthcare workers, that's something that the Women's Alzheimer's Movement is going to do. And I think also kind of also teeing off of like these conversations, this is a heavy time for a lot of people. And I would just like to recommend humor. Humor and music goes a long way to distilling anxiety. I did a really great conversation with a pastor on Sunday, Pastor Max Lucado, who's written many, many books, and who said, that the best way science has proven is to deal with anxiety. One is to write down a gratitude list, because gratitude and anxiety cannot coexist. The other best way to deal with situations like this is to think outside of oneself, and also laughter and music. So many people, I remember my dad, he'd be so agitated all the time with his Alzheimer's, and I'd put on music from when he was a young man, and right away his tired demeanor would change. And he would all of a sudden get a smile on his face. We know much more today about the power and the science of music, but there are other things that are out there when you want to get some levity, when you want to get some break from all of this, whether it's the news, whether it's those meaningful conversations that I always advocate for. But just put on some music, put on something fun, let it go back in time, have a little bit of joy, even though it feels like the world is crashing down. Sometimes what they call it reminiscence therapy, sometimes kind of going back in time to hear songs and things. There's a lot of science and research behind the fact that that does work.
Yeah, such great advice. And we know that families are overwhelmed by all the time that they're spending alone right now, and all of those redirection techniques, all of those things that can help to provide a little bit of distraction and support. We want you to call all of the resources that we've talked about today. We are completely out of time, and I can't believe how quickly that it went. I want to thank the lovely esteemed guests that joined us today, Kim, Dr. Canio, and of course, Maria Shriver. Your leadership is unprecedented in this state, and we are so lucky to have you. Just really quickly, 833-544-2374 is that special COVID-19 line that Governor Newsom has set up, 211, and of course, call 24 hours a day, 7 days a week, 800-272-5787. 3900. We will post answers to questions. We will connect them to people as you need them. And we thank you all for joining us today. And hopefully we'll be able to do this again. So take care, everybody. Stay safe, stay soapy, stay positive.